Hello, Wise Tribe. Are we on? Still loading? Are we live? Hello, Wise Tribe, and I am here today to talk about non-invasive facial rejuvenation. Try saying that after a cocktail or two. I've had a coffee, that's good enough for me. I'm here with Dr. Jonathan Lee at
Hello.
the Aesthetic Studio, and we're here to talk about how to enhance what nature has given us. My personal approach is to try and leave things as they are. I have not had any work done, just for the record. I haven't had anything aside from a standard facial, kind of hydrating, skin improving kind of thing. But I am starting to see the effects of aging. I am now 41 years old and starting to, wonder what is out there. If somebody would like to think about maybe slowing down the clock and looking at treatments that are not facelifts, not going under the knife, safe, easy procedures to enhance what we've got. When should we start thinking about treatments like this?
Well, first of all, thank you for having me, and I think it's always lovely when we get guests, and you certainly don't look 41.
Thank you.
But to go back to that question about when should you start,
Yeah.
I think it's going to be different for everybody. Mm-hmm. And I guess the simple answer to that is when you start looking in the mirror and you start feeling like you maybe should. So if you're starting to feel like you're looking a little bit tired, most recently, it's the Zoom calls, right? People
Right.
are actually noticing how they look in front of the camera, and
Right.
they're starting to say, well, without the makeup, I'm starting to look a little haggard. Maybe that's when we should start. It's going to be different, again, for everybody. Different ethnicities as well, age slightly differently. But what we typically find is that women in particular might broach this question around 35 or in the mid 30s into the mid 40s. Like, this is typically when they first come and ask for treatments. And this is also it happens a bit like clockwork. You start to notice the pigmentation on the complexion. You start to notice the lines. You start to notice especially around the eyes, this sense of fatigue,
Right.
Dark eye rings, shadows underneath the eyes, lots of wrinkles, and maybe
Yes.
the brows are starting to look a little droopy. So this is
Yes.
typically where patients would come to me, and they might start to feel like they really need to start looking after themselves a little bit better. So I would typically start at around that age.
That's earlier than I thought you
you'd
would
have
say,
thought,
actually.
right? Yes.
But I guess there's merit in starting
Yes, absolutely. So
earlier.
one of these key concepts that I always try to introduce to patients is that it is always easier and better to do a little bit and start earlier and do it at regular intervals than to say to yourself, oh, I'm going to let those wrinkles accumulate, and and I have patients who do that. Like, they say, well, it's COVID now, nobody's looking at me. Like, let's defer my treatments for 2 years, right?
Right.
But and we also have those patients who are just saying, well, I'm just going to let it lie, and they come when they're 50 or 55, and there really is a lot more work to be done. And just remember that a lot of these age-related changes is damage to the skin, so this accumulates over time.
Right.
And what we're doing with a lot of non-surgical rejuvenative techniques that we have now, energy-based and injectables and so on, is we're stimulating the skin and starting these rejuvenative processes. So we actually can delay a lot of these age-related changes to the complexion, to the facial features, and so forth. So I still think that one concept that I try to get my patients into is to do a little bit at regular intervals, and that's going to be a lot better than trying to do an overhaul later on in life.
So it can actually be beneficial, and it can actually save you doing more work
Absolutely.
later down the line.
Absolutely.
Wow, that's interesting.
And in fact, it can sometimes be more difficult to reverse changes completely once they've really set in.
Right.
And we end up doing a lot more. It's more uncomfortable, for example, when those deep wrinkles have set in, when the
Yeah.
quality of the skin is deteriorated to a certain extent.
Yeah. So you get to nip things in the bud, essentially.
Yes.
Interesting. So once somebody has made a decision that they've looked at themselves in the mirror and it's time to go and seek an opinion or get some advice, what happens when a patient would come to you for a consult?
So, I mean, I'm a surgeon by trade, so, and I do treat functional problems. So I think we always have to look at this in perspective. What we're doing for ourselves is still fundamentally cosmetic. It's not life-saving, but it's life-enhancing. I think it certainly improves the quality of life, the way that we interact with people.
Yes.
If we can continue to look refreshed, feel refreshed about our appearance, I think that it does have long-term effects on our mood and the way we interact with people.
Self-confidence is huge.
Absolutely, our social interactions.
Yes.
So having said that, so how much risk you want to take on when doing some of these procedures is important. So I think that we want to do actually as little as possible and put patients at minimal risk as we have to for cosmetic improvements. And I think a lot of the techniques that have developed over the last decade allow us to do that. We just have so many more technologies now with the Botox and the dermal fillers and the energy-based devices and threads and so forth, that there seems to be increased demand for this, and less patients are actually putting themselves up to the risk of surgery with facelifts and so on. So back to your question, I think it's really important to find a doctor that you're comfortable with and have this long conversation to make sure that we're both, the doctor and the patient, are on board as far as what your tolerances are, what your main concerns are, whether your doctor understands that and can take you on this journey.
Yes.
So typically when a patient comes to me, and I generally I love working with patients who are just broaching the idea of maybe starting on some of these procedures, because I think it's very important for them to have the right concepts and to look at this as a long-term plan or journey. So they would come in and they would tell me generally what their main concerns are. And I like to have that conversation with them, and there's a little bit of education going both ways. So they might come in and say, well, I have this wrinkle, or I don't like the lines on my forehead.
Yes.
And I like to just step back and actually, I like also the emotional response. Like, how does that make you feel? Like, if they feel like they're looking tired, or their friends have given them some feedback that they may be looking tired, I like to focus on that, because I feel that the experience of the doctor is to be able to step back, look at the features and break it down into parts and say, well, these features are the ones that are actually contributing to you looking tired.
Yes.
These features are the ones that are making you look, like you need a weekend off,
Yes.
And so we would have that conversation, and I also, like we said before, try to work out a plan which will be comfortable for them, which will give them a high patient satisfaction up front. So we want to give them procedures that are comfortable, that they're willing to accept, that will rejuvenate them discernibly in the quickest possible time. But at the same time, we want them to have a clinical plan that might involve multiple stages to rejuvenate the whole face, not just the one wrinkle that they're obsessed with,
Yes.
So I think it's important, and I spend a lot of time in that first conversation, because I once we get on the right footing and they have the right concepts and they're on board with the process, and they can understand what we're trying to achieve for them in terms of rejuvenation anatomically, then we can embark, and generally there's a lot better experience and they're happier. So I think that you do need to find somebody that you can have that conversation with.
Yeah.
You want a friend in your doctor,
Yes,
essentially.
you definitely need to be on the same wavelength.
Absolutely.
And I love that you talked about the ideas behind why people are coming to you to get advice, because quite often it's difficult to be objective when you're looking at yourself in the mirror.
Yes.
You have ideas about which parts you're not happy with and why. But as you said, as a practitioner, you'll be looking objectively and try and understand the ideas behind that. I think that's really important, actually.
And of course, patients also are trying to. So what I see in the years that I've been doing this is that obviously patients are influenced by what they read, and what we read. Often there's the there's the topics that are popular at the moment. Botox
Trending.
is not talked as much about anymore, but it's really a foundational technique that we still feel should be the first thing that we start for most patients.
Oh, right.
And then they might be coming in and asking about a specific filler, which is relatively new, but that's not necessarily what they need. So they're trying to figure all this out. I think it's very important to have a doctor that really can get to the root of these things and use the best tools, not necessarily the most popular one or the trendy what's being marketed right now in the magazines sort of thing.
So that flows very nicely onto my next question, which is to talk about the different kinds of treatments that are out there at the moment. We're not talking about surgical procedures, let's just be clear about that. We're not talking about going under the knife. We're talking about injectables, and so that includes Botox, that includes fillers, that includes threads. Can you tell us a little bit about
So again, we have a variety of tools available. Injectables are a class, and within injectables there's the Botox, which we all know now is a toxin that helps to relax muscles. And this is a very useful tool because as the skin quality deteriorates over time and those muscles become increasingly active, it can shift a lot of the facial features, in particular the brow, and leave very deep lines, and also it can crease the skin, leaving deep lines. So botulinum toxin, there's many brands out there, but essentially it relaxes muscles, and we do it at regular interval. We can delay a lot of the descent and a lot of the change in relative facial feature positions that can look like the brows, for example, that can make us look tired. So we can delay this, but Botox is something that we need to use on a regular basis. Dermal fillers are different from Botox, not better, not an alternative. They're just different, and they're used for different indications in different areas to restore volume loss. So we studied facial aging over time. We know that there is loss of youthful volume in the face, and that again allows the features to descend. It's almost as if the balloon at the birthday party is always nice and taut, and as it starts to deflate, it's starting to look a little.
So you're talking about the hollowing out, and you're talking about the
so
jowls.
It happens a lot. The first place I usually start around the eye, so you have the tear troughs, what some patients might complain of, like visible eye bags, or dark eye circles, or hollowness around the eyes.
Don't look at me while you're saying that, please.
You look lovely. It also can contribute to these deep laugh lines around the mouth, some hollowing underneath the zygoma or the cheekbones. And in general, as these hollow out, the jowls also become more obvious, like this droopiness. We do know also that over time, the facial skeleton changes. So there is some bone loss, leading to lack of definition around the jawline and around the mid-face. So these are all areas that if we were to subtly and sensitively restore volume, we can restore the relative youthful proportions
with fillers.
And there's again, dermal fillers are very technically specific. Their behaviors, their rheology or their behavior, their biological behavior is different. But for the layman, I think I would say that we use harder fillers when we're rejuvenating, when we want projection, when we're rejuvenating bony prominences and so forth. And we use softer fillers, the more superficial, closer to the skin that we go to.
Okay.
Like where the skin is very thin, we use very soft fillers, or where there's a lot of movement or in a very dynamic area, we want a filler that responds with a certain amount of elasticity rather than the hard ones that we use to, say, correct.
So you don't get that frozen look. Yeah.
Absolutely, and it shouldn't bunch up.
Right.
It should really integrate really well. You shouldn't have like the big cheeks when
Hamster
you smile.
cheeks.
So we want to also use the correct filler for the correct indication so that the dynamics looks very, very natural.
And quickly, threads?
So threads are a different concept altogether. They're largely, there's two kinds of threads. They're implantable. The first type of threads has a collagen stimulating type of effect, and there are multiple small threads. And again, we can use them almost like fillers to stimulate collagen and fill hollows. They also have a little bit of a firming effect. And then there's the suspension threads, which have cogs or little barbs on them, and we can use those to redistribute saggy skin, like a lift.
Wow.
Okay, so we can, when we place them and then we reposition, and they can help to suspend loose tissue. So I like them for dealing with jowls and lower jawline issues where there's a lot of sagging to sort of get better definition around the jawline and to reduce jowling. So putting all these techniques together then is quite important. They need to be layered, and they're synergistic. Using them together gives a better result, and using them sensitively can give you a very natural result. And we're just really working with what you've already got there and restoring them. We also have energy-based devices. This is also quite important. So these are non-injectable devices like the Thermage, the Altheras, which will also help to deep heat, tighten, and stimulate the deeper tissues.
Okay, very interesting. So some quick fire but very important questions. These treatments that we've been talking about, are they safe?
They are safe. So in Singapore, naturally everything has been licensed, and interestingly, if you go into our licensing, we actually have to be licensed. A lot of the products we use are licensed in at least 3 jurisdictions. So that's American FDA, locally, either Europe or Korea or Japan. So they are safe if they're licensed and you're doing them in a proper clinic. But I also want to say that as far as safety is concerned, it's very important to work with someone who's experienced and someone who knows what they're doing. So there is a small but still present risk of doing any procedure, right? Even obviously knowing like even vaccinations have this minute risk. So all injectables do have some minor risk. These are very, very, very manageable and almost completely avoidable if we follow protocols, if the doctor's experience is there, he's used it, and his understanding of the anatomy is robust. Where to avoid the nerves, where to avoid the blood vessels, and so on. And he really has to be really gentle about injecting, looking for signs of problems that may arise. Here at our clinic, we take our patients through very carefully. So they're checked on for the first 2 days by our staff to make sure that everything's going well and so forth. Regular follow-ups are also important. So first timers, especially if it's the first time you've had Botox or the first time you've had a dermal filler, we always get you back within 2 weeks to make sure that the results are what we expected. And often we can touch them up. So I think it's also very important the doctor's experience in knowing how to manage some of these unexpected results. If you're not happy with the filler, which ones can be dissolved. If the Botox is somehow asymmetrical, how those can be rebalanced. So experience is important as well in managing safety. It's not just about the product, it's also about how it's used. And I also try to caution patients in terms of focusing too much on the product or the brand. Rather, it's important that the doctor that's performing the procedure on them knows how far he can take it, knows what kind of results he can deliver, and that's not always translatable from one doctor to another. So those are all the little key points to make sure that you get the result that you're expecting. And
Yes.
Again, it brings us back to that first consultation and that
Yes.
conversation. You can't always take, the march isn't always the same in every doctor's office. It really depends on how they apply it. Similarly, and that's all the more true for injectables, there's a lot of artistry involved with Botox and fillers and threads and so forth. Getting that technique right, it's going to vary from doctor to doctor. So when they say, I can give you this kind of a result with this kind of a product, that doesn't necessarily translate into another doctor's office. So they're just tools, and
Yes.
they have to be used sensitively for the correct indications on the correct patient to deliver the results that the patient will be happy with.
That sounds fantastic, and I think that's a really great place to wrap up, actually, because that really sums up what this is all about. It's about tailoring things for the individual, taking in consideration the patient's goals and aims and their approach
Absolutely.
to aesthetics. Thank you so much for your time today.
Like I always say, it is a journey, and we really want to be partners with our patients.
Absolutely, and I look forward to having a good chat with you now about
Thank you.
me.
Oh, you don't need any.
Thanks, Dr.
Okay,
Jungwon Lee.
Thank you for having us.
Speak to you again soon.